the 75th World Health Assembly is dealing with several very important topics for the Americas. Certainly the sustainable financing topic, that agenda item deals with increasing resources for WHO that will ensure that we are able to deliver on what are the important resolutions that member states have passed and how to continue to bring that support to member states. Of course, it is being passed in WHO, but the Pan American Health Organization does get funding from WHO. So if the funding for WHO increases, we expect that some funding to PAHO will also increase, and this in turn will help us with the technical cooperation to our member states. Other important topics being addressed here, it includes the strengthening of WHO for emergencies. You know, we are coming out of the COVID emergency, and there are many lessons that have been learned. So how do we ensure that WHO and by extension PAHO are better prepared to face emergencies and to ensure that we can deliver at a very high level. And sort of also aligned to this is also the international health regulations, what needs to be put in place to strengthen international health regulations, the discussions around also our health treaty for emergencies. Of course, a very important topic of non-communicable diseases, NCDs, and mental health. In the region, we are making some strides, but we are going to have to make really a Herculean effort to address this tsunami of non-communicable diseases and how we ensure that these are embedded in the first level of care, in the primary health care, and supported by secondary care. Another topic that we need to address is the health workforce. And of course, you know, there is no health without health workers. And so how do we ensure that health workers are trained adequately? How are they well distributed? How do we ensure that they continue to be motivated to do the work and supported? How do we ensure that they are well remunerated? And how do we protect them from violence? Because there is a growing level of violence against healthcare workers. These are some of the really very important topics among others. Of course, we will be looking at the health system, and particularly in one of the side events, as to what do we really need to do to ensure that the first level of care, our primary healthcare system, is strengthened and ready to ensure the transformation of health systems that is required as we go into the future, as we prepare ourselves much better to face another pandemic, but also to deliver on what are the essential programs for our citizens.